Hi everyone, welcome to my channel. This is your nurse, that's nurse NG. So today we are going to discuss postpartum hemorrhage. Postpartum hemorrhage is simply the excessive loss of blood during childbirth. Immediately after the birth of the baby, some women tend to lose a heavy amount of blood. They tend to experience a heavy loss of blood, which could be up to 1000 milliliters or above or even slightly below. Now, usually after the delivery of the baby, there's usually a little loss of blood, like 200, 150, 100, or thereabout. But when it comes to postpartum hemorrhage, we tend to see a heavy loss of blood. We tend to see a heavy bleeding that can push this woman into shock. So when this woman loses this heavy blood or this high volume of blood, the woman tends to go into shock and this can lead to death. That is why postpartum hemorrhage is one of the major causes of maternal death. When it is poorly managed, when it is not managed well, this woman can die. Right? So there are causes to this postpartum hemorrhage. It doesn't occur on its own. The woman doesn't just stay and start having postpartum hemorrhage. There are factors that can lead to this postpartum hemorrhage. Now, one of the factors is when the uterus lacks contractility, like when the uterus fails to contract. Ideally, after the birth of the baby and then this placenta, after the delivery of the placenta and everything, the womb or the uterus supposed to start contracting with the help of the oxytocin, and that the womb supposed to start contracting. But there are some cases whereby instead of the uterus to contract, the uterus doesn't contract as it should contract, or it fails to contract. The muscles become floppy and is not firm, is buggy, right? So in this situation, the uterus fails to contract, and instead of contracting so that the blood vessels can constrict and reduce the bleeding, no, it doesn't happen. Rather, there's no contraction, leading to inability of the blood vessels to constrict and control blood flow, and this will lead to bleeding, heavy bleeding in the after delivery, and this will cause the woman to start bleeding heavily. So, and there are things that can lead to this uterus, make this uterus not to contract. One of them is multiple pregnancies. What do I mean by that? That is when the woman has a twin gestation, let's say triplet, quadruplet, and so on. So this can kind of expand the muscles. It can stretch the uterus and cause the uterus to lose its elasticity, thereby making it difficult to contract as how it should, right? Then another thing is when this woman have gone through several deliveries, like when we have a multi-grand gravida, when you have women that have gone through the process of labor and delivery, like up to the eighth time or even the ninth time, or even some persons they have gone into the labor room more than 10 times or 11 time or the 12th time. So this situation can cause the uterus to lose its contractility and makes it difficult to contract and control the blood loss. Then another thing that can also cause this postpartum hemorrhage is when there is something that is still left inside the uterus. You know, After delivery, the uterus is supposed to be empty. Nothing should be there. No fragments, no tissue, nothing should be inside. But when there is something still left there, it will not make the uterus to contract, thereby leading to bleeding as well. So when there is a fragment, let's say for instance, during the delivery of the placenta, one piece or something got struck into the uterus, it didn't come out with the rest. That can lead to bleeding. And in most cases, the bleeding doesn't even happen immediately. Let's say after 24 hours or 48 hours or even 72 hours after delivery, that's when the woman will start noticing the bleeding. The lochia wouldn't stop as it should, like progress and then eventually stop. Rather, you will continue to see bleeding, fresh blood, bleeding and clots and all of that. So when the woman goes back to the hospital and they will do examination, that will be when they will realize that, oh, maybe there is one thing or the other that is still inside the uterus. In that case, it means that the tissue or the item or something that is there is what is causing the bleeding. So this is one of the causes of this postpartum hemorrhage. Then another factor is when the woman has issue with coagulation, clotting factors, what we can call coagulopathies. So this woman will find it difficult for her system to clot blood. It will be difficult for her system to manage bleeding, to arrest bleeding on its own, right? So in that case, if this woman sustains injury or there's anything, just like I have mentioned, the uterus unable to contract, there is tissue or anything or even laceration, it will be difficult for this woman's system to activate the clotting factors. So because of the disease, because of the issue with coagulation in the body. Then another factor is laceration, that is trauma. So when there's laceration, when there's injury in the perineal area or cervix or vagina, this could lead to bleeding. So in this situation, the woman will bleed from those injured areas until it is repaired. The bleeding will not stop. So these are the causes of postpartum hemorrhage. And when it is not adequately managed, let's say in the case of laceration, it has to be sutured. If it is not sutured or if it is not noted, if that laceration is not noticed or observed, and the woman leaves the labor room without repairing the suture, without repairing the laceration, it will lead to bleeding. This is how and why postpartum hemorrhage occurs. So if these factors are not well observed and managed, this woman will bleed, and from the bleeding, this woman will go into shock. This is how postpartum hemorrhage leads to death. Please kindly subscribe to my channel and share this video. Bye.